All right, Paul Eisner joins me now. Paul, tell me, you're naming this after a man who's accused of murder. Why name it after him, regardless of how important this legislation might be?
It basically was designed to get attention to the issue and get publicity for the issue.
Okay. Well, you succeeded there. There have been plenty of videos and examples of doctors talking about insurance companies refusing to cover things. There was one doctor who talked about the fact that the insurance company was refusing to pay for a wheelchair for his patient, who was a double amputee, and demanding that the doctor prove that his patient couldn't walk.
Okay. It wouldn't surprise me.
Yeah, those kinds of stories you hear about a lot.
I have not heard that one, but that's the first time I've heard that one.
Okay, tell me what your bill would do, how this would work.
The bill basically says insurance may not delay, deny, or modify medical procedure or medication, or reduce payment where the treating physician, where the delay, denial, or modification could result in disability, death, amputation, permanent disfigurement, loss, or reduction of any bodily function.
All right, well, how do you, the health insurance industry says we're not delaying or denying. We're just simply doing due diligence.
There's also a provision that if, first of all, if they're delaying or denying, they have to have it reviewed by a physician. They can't, it's not an insurance person, it's by a physician. Secondly, there's also a remedy that if they act improperly in the event a lawsuit is filed by any insurer who sought to delay, deny, or modify or reduce their payment, etc., they have the burden to prove by clear and convincing evidence that it was unnecessary, not result in disability, amputation, permanent disfigurement, loss, or reduction of bodily function, and they're liable for treble damages and attorney's fees. There's a civil remedy in there.
All right, so back up a second. Who's making these decisions? So your point is that it's not doctors who are second-guessing the doctors, it's accountants?
I've heard that people, I've never worked in the insurance industry. I did a short period where I was representing insured defendants, but that was liability insurance mostly, but that was not one of my favorite areas of practice. But it basically says that a decision to delay or deny a modification must be made by a physician, and it makes it a felony not to use a physician to delay, deny, or modify.
So what are the chances this is actually going to will pass, this legislation you have introduced?
It's something that goes, the way it works in California is you have to gather over 500,000 signatures. I don't know the exact amount, valid signatures. It then goes on the ballot. The voters decide yes or no. It's a proposed section amendment to the Health and Safety Code. I think it needs a simple majority. If it passes, it becomes law in California.
Do you think the chances are good it'll pass? There's a lot of public outrage. We saw that after Luigi Mangione was arrested for the murder of the United Healthcare CEO. A lot of Americans are very, very frustrated.
I have not gathered any poll. I've had emails calling me sick, evil. One person saying that they hope me and my family are killed by a bunch of deranged assassins. That's the extreme. I'll eliminate the profanity in that one.
Wait, but who are these from?
I just get email. My email address is public, and that's just in the emails that I've been getting.
Are you getting any backlash for naming this after Luigi Mangione?
I'd say about a quarter of them complained about naming it after Luigi Mangione. I had one call on a different issue from somebody from North Carolina earlier today. I had an email from someone in Kansas suggesting I contact the Kansas Attorney General to try and get a similar thing in there. I'm getting emails I'd say are probably about 3/4 positive, and most of the negative ones complain about naming it after Luigi Mangione.
All right. Fascinating, but it's obviously an issue people have a lot of strong feelings of. A pretty healthy chunk of healthcare claims are denied by insurance companies, and medical expenses are the #1 reason for bankruptcies in this country. So it's an issue. Paul Eisner, thanks for joining us. Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.